In today's To Your Well-Being, we are talking about what you should know about colon cancer and the importance of early detection. Nurse Christine Brannick is the Oncology Outreach Manager with Cone Health. So she is going to be the one who is answering all of our questions. So let's first off just talk about this. What exactly is colon cancer?
So colon cancer basically is cancer of the large intestine. So the large intestine is our colon, and the last few inches of the colon is our rectum, and that's where rectal cancer
Okay, so
occurs.
two different kinds of cancers, colon cancer and rectal cancer. Who's at risk for colon cancer? Are there certain groups that are at higher risk?
Yes, so most colorectal cancers occur in individuals over 50, but we have seen a lot more colorectal cancers in individuals under 50. So they did decrease the screening rate now to 45. It was 50. Also, some other things that could put at increased risk, obviously a family history, like if your parents, your grandparents, siblings would put you at a higher risk. If you have a confirmed diagnosis or suspect of colorectal cancer syndrome, such as the Lynch syndrome. It is a genetic syndrome. There is genetic testing where you could, if you were at high risk for that, and it is actually done here at the Cone Health Cancer Center. Also, if you were to have a family history of adenomas, which are basically precancerous polyps, or if you had a personal history of those polyps. Obviously, if you had a personal history of colorectal cancer, if you've ever had a history of radiation treatment to the abdomen or pelvic area to treat a prior cancer, if you've had any inflammatory intestinal conditions such as ulcerative colitis or Crohn's disease, those individuals, obesity, smoking, heavy alcohol abuse, sedentary lifestyle, low fiber, high fat diet, all those things would put you at an increased risk for colorectal cancer.
All right, so let's talk about what are some of the signs maybe that we should be looking for that could be a symptom of colon cancer and what should prompt us to kind of contact our healthcare provider. So first, let's go over the symptoms.
So some of the symptoms, the first one you might notice is a change in your bowel habits, such as if you're going more frequently, less frequently, more diarrhea, constipation, or if you're even seeing a change in the consistency of your stool, like if your stool maybe look like a pencil. They're very narrow because if there's a tumor in there, it could be blocking that colon and making it harder to get through, which narrowing those stools out. It could also be any bleeding of your rectum or in your stool. Persistent abdominal discomfort. This could be cramping, gas, pain. If you have that sensation, your bowel just is not emptying. You just went to the bathroom and then you still feel the need to go. Weakness, fatigue, or if you had any unexplained weight loss, those would definitely all be symptoms that you would need to report to your provider and have checked.
Right, so if any of those pertain to you in any way, shape, or form, this is now when you should be taking action to call your doctor and at least get a checkup and see where you go from there. So for some people, these symptoms may be uncomfortable to talk about, or the person might associate it with other things like irritable bowel syndrome. So how important is it to not wait to get checked out for colon cancer?
It's very important because if we can find a colorectal cancer earlier, the greater chance of treatment and survival. There's so many treatment options. We've came so far that if we find them early enough, then like Julie said, patient may not need chemotherapy. If we were to find them when they're a pop before they even develop, as I'll talk here in a minute about the colonoscopy, you wouldn't have to do anything except to have that procedure done and remove that polyp.
Okay. All right. So then you go to the doctor and, you want to get tested. How is colon cancer diagnosed?
So the gold standard is that colonoscopy. And as I mentioned earlier, the recommended screening is to start at 45. Typically, it's every 10 years, though if you have one of those risk factors that I mentioned earlier and maybe more frequent, like 3 or 5 years, it's very important to talk to your provider about that. Then there's also other tests that can be done. They can do what they call a virtual colonoscopy. It's basically like where they do a CT screening. Though typically if they saw something, they would need to do a colonoscopy to actually diagnose. They can also do a sigmoidoscopy. Those are usually, if they're done, they're every 5 years. The only disadvantage to those is that it doesn't check the whole colon. It's only part of it. There is some at-home testing, like the FIT test, which is the fecal immunochemical test, where it's basically a stool sample that's sent to the lab. It's a one-time sample that's sent, and it can detect hidden blood in your stool. There's also some people may remember the old way that's not used as common, but it's still done. It's what they call a fecal occult blood test. It's like the stool cards that we used to give out, and some providers do still do those. It's usually a sample 3 days in a row, typically, or 3 stools in a row. You would do a sample from each of those, and that again detects hidden blood in the stool. The only disadvantage to that screening is you do need to follow a specific diet, and sometimes some of your medications may need to be adjusted, or you need to talk to your provider about during that period of time. Also, there is what they call a color guard. Some people have probably heard of that, and that is a DNA test of the stool. That is done every 3 years. And again, any of those tests, if they came back showing anything, you would still need a colonoscopy ultimately.
Okay, we're going to talk about what happens like if you delay the colonoscopy during COVID-19, because a lot of people delayed getting any kind of health procedure or anything done in that last year and a half or so. We're going to talk about that and much more coming up in the next segment. We'll be right back in just a few minutes.